Welcome to another edition of Cancer Facts with Dr. B. Today I'm going to start a series on how do I determine the best treatment for my cancer. To best answer this, let's consider this phrase, care about me. I'll go through each letter and what that letter means, and this will give you the ability to discuss your treatment options with your doctor. C stands for cancer control. What is the cancer control rate between treatment A and treatment B the first time around? The main question is the cancer curative or not? Sometimes we offer recommendations that are not curative, but they will help a side effect, or they may help simply prolong your survival. The other thing to consider is to discuss this in absolute terms. A lot of times as doctors, we like to give relative benefits like a 50% improvement, but as a patient, you really want to know an absolute difference. Is this going to help 2 patients out of 100, or is this going to help 50 patients out of 100? Sometimes we use the term definitive treatment or adjuvant treatment. An example is women with early stage breast cancer. The definitive treatment is surgery, whereas the adjuvant treatment is radiation and chemotherapy. The adjuvant treatment is considered an adjunct to the main treatment to try to help mop up any cancer cells that might be in the breast or the rest of the body. The last thing to consider is what is the endpoint we're talking about? Is it overall survival? Is it cancer-specific survival? Is it metastasis-free survival? These are definitions that I talked about in my previous talk. Next is the letter A, adverse events. What are the side effects of each treatment? What are the short-term side effects of the treatment, and what are the long-term side effects of the treatments? The other thing to consider is how severe those side effects will be. A lot of times as doctors, we will give it a grade as to how severe, going from 0 to 5. 0 being no side effect at all, to 5 being a side effect that leads to death. Next is R, or retreatment. What's the chance that I will need a second line of treatment, or what we call salvage treatment, for my cancer? It's one thing if the doctor says, hey, we have this great treatment, it has very few side effects, but you may need retreatment 90% of the time. That's something to consider. Next is E, or the expense. As doctors, we don't always know what the out-of-pocket expenses are for each of our patients. At that point, it's important for you to be able to ask your team, what will be my out-of-pocket expenses, which may require a trip to the finance office to determine that, or even a call to your insurance company. Last is about me. What will my quality of life be? This can be very difficult for doctors to communicate that because it's very difficult to study. It's very similar to the side effects, but it really does ask the question, how does that side effect impact my quality of life, and how did that treatment impact my quality of life? As doctors, we will review treatment options for you, and from those options, we will make a recommendation. This phrase will give you the best tool for you to use to determine which cancer treatment option is best for you. I hope this is helpful, and stay tuned. I will go through each of these letters individually to kind of give you a better sense of what you can discuss with your doctor. Thank you.